So we know that this is the situation that has happened through this call attention that I have raised from the Health Department that has happened on the 19th of February 2021 in Sohra CHC. So with regard to this issue, we know that Meghalaya has an IMR rate of 34 out of 1,000 child. In India, in 2020, IMR is 29.8 per thousand, and in 2021, 28.7 per thousand. And in our state also, sir, last year in the statement issues from the Health Department that around 877 newborn have died and 61 pregnant women have died due to multiple reasons between April and July 2020. Having said so, sir, this is a very alarming situation that has happened in our state through the healthcare institution within our state. I would like to bring to the notice of the Honorable Minister, the Health Department, the government, that it is there, several districts of our state, the lack of facilities, the lack of the coordination between the healthcare system and the family at the ground need to be checked into. I had an opportunity to visit to different assembly committee in different districts like Southwest Garo Hill, Southwest Khasi Hill, and other part of this state. We have seen that there is an alarming number, an increasing number in the infant mortality rate as well as the maternal mortality rate. Sir, I'm not saying that the health department are not doing anything. There are certain districts, there are certain PHC and sub-center which are doing very well. For example, the Marangar PHC I have visited just 3 weeks back, where the IMR is nil within last year, and IMR also very low case. This is just an example, sir. There are so many PHCs within our state that they can maintain and they can perform well, and the health system, the healthcare system, it can reach up to the ground. So this very incident which has happened in Sohra on the 19th of February 2021, it is an eye-opener to all of us that the health department has to check and balance to see that everything is well at the ground. Sir, at the same time, I would like to bring into the notice of the House, and I would like to know that what steps has been taken by the government to improve the facility of the ASHA. Sir, once we talk about the issue of IMR, MMR, apart from the duties function performed by the doctors, the nurses, they have been working days and nights, 24/7, no doubt about that. I appreciate the steps taken by the health official. And then at the same time, this ASHA also, they have a great role to play, ASHA worker, to bridge the gap between the health system and the people at large at the ground. This morning, I read newspaper, ASHA, they have their own issues. They are demanding for their dues, they are demanding for their fixed honorarium. They asked the other state has been done. They are demanding about the pending incentive like the ASHA benefit scheme and the other benefit scheme which are there, and the issues, the incentive that they have to avail through the PMMVY by filling up the form, which is very difficult for the ASHA workers also. I would like to know from the government what steps has been taken in this issue. So apart from this, through this call attention, I would like to know the mind of the department that steps taken through the Meghalaya Health System Strengthening Project, this World Bank project, how to encourage that the sub-center and the PHC, they will perform more and more institutional delivery in working together with the health worker and the ASHA at the ground. We want to know. And we would like to know also the staff, the doctor, the nurses, they had the strength in the major hospital in our district, in our state, the strength, the difficulties, the grievances, and the shortcoming of the specialists. We know there is a shortcoming of the specialists like the pediatrician, anesthesiologists, radiologists, and many specialists. There is a shortcoming of this. We would like to know through this call attention, sir, because this it relates directly with the healthcare system that has to be provided to the child at the ground. At the same time, sir, we would like to know from the Honorable Minister the status of the partnership with the Public Health Functional of Foundation of India and the Indian Institute of Public Health, to how far they have addressed this problem, this issue, with regards to bring the healthcare system with regard to IMR and MMR in our state. At the same time, sir, we would like to know the initiative taken by the government to address the issues that the government has come up with the idea for immediate training for postgraduate, for diploma course to address the shortfall of specialists within our state. At the same time, sir, I would like to know a proper examine and thorough diagnosis has to be done. Like this case has happened not only in Sohra, it has happened in Ganesh Das Hospital a few months back that the child has died. So we would like to know what are the proper procedure that has to be followed, proper diagnosis has to be done properly by the health worker in our state. At the same time, sir, we would like to know, because this directly relates with the emergency function of the health system in our state, the position of the ambulances, the position of the EMRI. Sir?
Please wind up.
It's not yet 8 minutes, sir. Just 7 minutes, 1 minute left. I have a clock here to check. Yeah. Sir, this is the last issue. The issue of ambulances, that there should be proper ambulances at the ground so that they can attend and address this immediate requirement. At the same time, the issue of the Meghalaya Emergency Management Institute Worker Union, the job security, the absorption of the job, all this issue, because it relates directly, sir, with the issue of how to deal with the emergency system that need to be addressed at the ground. So, sir, this is the issue that I would like to know from the Honorable Minister through this call attention. So thank you for allowing me 1 more minute, and we would like to get a categorical response from the Honorable Minister through this call attention. Thank you very much, sir.
Honorable Minister, please.
Honorable Deputy Speaker, sir, I am thankful to the Honorable Member Shri Meral Bon Sim, Honorable MLA from Nongpo Assembly Constituency, for calling the attentions on the matter appearing in the daily newspaper, Mofo, dated 25 February 2021, under the caption, Klat Ikulum Padang Shukha Sohra CHC, Panjwab Ka CHWO, like a health department. So I'd just like to take this few points which I'd like to clarify in this August House, and also for the benefit of the member who is moving this call attention, and also all the members in this August House. He also mentioned about the infant mortality rate and MMR, sir. This is not only because of the hospital or the healthcare. Are the complex issues. Huh? There are so many issues in this. It might be for the social strata, it might be for the family, environment, and many other issues. Huh? So it cannot be squarely blamed to the healthcare sector. Huh? And also talking about the step taken for the ushers. See, the government has given immense incentive to the ushers, and also depend on their performance. As much as they have performed, definitely the government has given different incentive to the ushers. Sir. So talking about the short of the specialists. So the government, to address the shortage of the specialists in the states, the Meghalaya is one of the states in the country with the highest infant mortality rate, IMR, and also maternal mortality rate, MMR. The cause of contributing to high MMR and MMR are multifactorial. One of the key aspects in the lack of specialist doctors to cater the clinical and curative aspect of the maternal and child care, sir. Addressing the shortage of medical specialists in the states will have a massive role in enforce the clinical management dimension in the states. Therefore, the department has taken an initiative to respond to the perpetual shortage of specialist doctors in Meghalaya by launching a Dutch project, design and adoptions of alternate models of responding to the address shortage of the medical specialists. That is also not only that, sir. Last time also we had called the advertisement for the specialist doctor, but nobody has come to apply for the post, sir. So far, in collaboration with the College of the Physicians and Surgeons, the following courses, namely Diploma of the Child Health and the Diploma for the Gynecology and Obstetric, will be initiated in the Ganesh Das Hospital. Sir, I'd like to come to the main point for the incident which has happened in the Sohra CHC. So I would like to provide a brief details about the case. The patients came to the Sohra CHC on the 19th February 2021 at 4 p.m. with a complaint of pain abdomen and decrease in fetal movements. She was admitted in the hospital and was taken to the level room for examinations. From the history, the patient was noted to be the sick gravida having 3 antenatal checkups along with blood investigations done on 8 January 2021, but no ultrasound sonography despite the same being advised and done every Wednesday in Sohra CHC, but the whole Shela, Balaganj block and adjoining areas. On examinations, she was found to be a term-sized pregnancy with fetal heart rate only 100 per minute, which indicate fetal distress. In view of the condition of the baby, it was explained to the mother and the attendant and accordingly advised to attend a higher center, Ganesh Das Hospital, Ganesh Das Government Maternal and Child Health Hospital, Shillong. Since there is no pediatricians in the CHC, that the Dr. Kandior obstetrics and gynecology specialist was not in station as he had to attend court cases in Shillong on 17, 18 and 19 February 2021. But the patient refused to go to the Ganesh Das Government Maternal and Child Health Hospital, Shillong. Since the patient was not in active labor, she was shifted to the antenatal ward. At about 9:30 a.m., the patient complained of pain abdomen and she was taken to the labor room for examinations. The patient was found to be in a labor and was kept in a labor room for delivery along with the staff nurse on duty. The mother spontaneously delivered a male stillbirth baby at 10:15 a.m. weighing 2.3 kgs. The vital signs of the baby were absent and resuscitation was done, but there was no response. Post-delivery, the patient wanted to undergo postpartum sterilizations and accordingly investigations were done, but her hemoglobin level was found to be 5 gm DL indicating severe anemia. The operations was withheld. 2 units of the blood was transfused on 20 and 21 February 2021, respectively in the CHC. Following blood transfusions, her hemoglobin level increased to 9.2 gm DL. However, the patient refused to undergo postpartum sterilizations and then discharged on the 23rd February 2021. As per the hospital record, the mother was provided due care and there is no negligence on the part of the hospital staff. Further, the Sohra CHC has been providing excellent healthcare services, and in 2019, the total number of deliveries at the CHC is 226, with 213 normal deliveries and 13 cesarean sections done with 161 reference. There was only one neonatal death in the year, that is in the month of February. In the year 2020, the total number of deliveries under CHC is 487, with 329 normal deliveries and 158 cesarean sections done with 73 referrals and 6 neonatal deaths. 1 month on April and 1 in April April and one in the 2nd May. One in the September and one in November. In 2021, January and February, the total number of deliveries is 71, with 51 normal deliveries and 20 cesareans section done with the 6 referral and 1 non-natal death. For the past 3 years, there were no maternal death, and this can be attributed to the good performance of Sohra CHC. The Health and Family Welfare Department has been giving extra emphasis on reductions of infant mortality rate and maternal mortality rate, especially during the COVID-19 period, through the weekly meeting at the NHM level as well as the state level, when the maternal and the child health scenario in all the 11 districts is being reviewed extensively. This extensively weekly meeting have brought to the fore absolute number of maternal and infant and the child death. The weekly reviews have revealed that the underlying cause of high maternal and child death in Meghalaya can be attributed to not only clinical management or public health management, but more so the underlying, often unaddressed socio-economic or the gender dimensions. This makes it all more important to create awareness on this issue and initiate discussion from all sections of society, and the government is doing just that. Lastly, sir, I welcome all suggestions from the honorable member of this August House and all sections of society which will help in our endeavor to build a healthcare system as per aspirations, needs, and requirement of the people of the state. I hope with this few submission, I have satisfied the honorable member.
May I request honorable member whether he would like to seek any clarification?
Yes. I would like to thank the Honorable Minister for elaborately reply, try to respond on those issues. As I have said in my submission, sir, we salute all the health workers, the doctor, the nurses, all concerned within the health department for their enormous job at the ground 24/7. My intention to bring is done, to this call attention is done. We would like the state to be improved, to improve in the IMR and MMR rate from now on. We would like to see more proactive steps to be taken by the government. So we'd like to see in days to come that brighter future, and we would like to see that this rate will come down. That is my submission, sir.
So we welcome the submission given by the honorable member. I also like to clarify a little bit, which is, I have told that it came to Sohra, the patient came to Sohra CHC at 19 February 2021 at 4 a.m., sir, not at 4 p.m., sir. This is my clarification, sir.